और डिफरेंशियल डायग्नोसिस की बात करें तो उसमें आता है मेजर डिप्रेसिव और बाइपोलर डिसऑर्डर विद साइकोटिक और कैटाटोनिक फीचर्स, स्किज़ोअफेक्टिव डिसऑर्डर, स्किज़ोस्क्रिनोफॉर्म डिसऑर्डर एंड ब्रीफ साइकोटिक डिसऑर्डर, delusional disorder, schizotypal personality disorder, obsessive compulsive disorder and body dysmorphic disorder, post-traumatic stress disorder, autism spectrum disorder or communication disorder, other mental disorders associated with a psychotic episode. Comorbidity की बात करें तो उसमें आता है substance related disorders, tobacco, smoke, cigarettes, anxiety disorders, panic disorders, schizotypal or paranoid personality disorders, life expectancy is reduced in the individuals with schizophrenia because of associated medical conditions, weight gain, diabetes, metabolic syndrome, cardiovascular and pulmonary disease, poor engagement in health maintenance behaviors, and other disorders include medications, lifestyle, cigarette smoking, diet plays a role. For psychosis and medical disorders may explain some of the medical comorbidity of schizophrenia.